everybody. It is Friday. I can't believe it. We're here again. Friday. It's been a whole week. Things have been crazy. Had lots of stuff going on this week. Did some traveling. Was out of the office a little bit. But I always look forward to Fridays because Fridays are when I get to hang out with my friends and jump on here and do some live stuff and share my friends with you. So let's go ahead and get this started. My name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, CEO of Tennessee Health Advocates, and founder of The Circle, where advocates surround patients with support. That's what I do on a daily. But on Fridays, I get to hang out here with you all and I get to share my friends with you. And the truth is, I hang out with some pretty amazing people. And so I'm excited to share with you today my friend Julie Neff. There she is.
Good
Julie,
morning.
thanks so much for joining us today. How are you?
I am great. Thank you for the invitation.
I love it. I love it. So, where are you joining us from? I
I
know I'm in
am
Michigan now, but where are you?
I am outside of Columbus, Ohio.
Nice. Nice. Ohio, Midwest folks. It's no wonder that you and I are friends. I am also from the Midwest, and so I think that we just kind of naturally gravitate towards each other as Midwesterners.
That's
So
right.
listen, I love this. Julie and I share so many passions and so many things, one of which is medical bills. We're both like in the whole issue of medical bills, health insurance, blah, 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 all of the things. And so I really want to give Julie the opportunity to talk a little bit about how she came to get so intimately involved with medical bills and health insurance. Julie, how did that happen to you?
I think like a lot of other independent advocates, it happens many times because of circumstances that you just stumble across. You are looking for challenges out there with your medical bills and your medical claims, and they just kept happening. And I used to work for an insurance company as a case manager in the
Oh,
perinatal division, and I was totally um, amazed when I scrolled through my screen at work, the millions and millions and millions of dollars that went unpaid because people made a mistake or didn't code something right or didn't submit their bills on time, and the claims would drop through the system and go unpaid, and they remained unpaid.
isn't that crazy?
And
So do you see that too, right? All of these errors. I was talking to somebody the other day about all of the opportunities for errors in medical billing, and it's crazy, right? It's
yes,
crazy how many opportunities. Tell us a little bit more about some of the errors that you see in medical bills.
most of the medical bills that I get, um, back then, they were almost all coding errors. So
Mm,
when the codes didn't match up, the procedure codes didn't match up with the diagnosis codes, they would drop through the system and go unpaid. And when I worked at the insurance company, and it was a national insurance company, there was nobody there to catch those and look at
wow.
them and make an attempt to fix them. That
Hmm.
bothered me a lot. And then we were incentivized to get people off the phone as fast as we could and not educate them. And I enjoy educating people. And we were
I
incentivized in monthly meetings to treat people that way. So what I see now are
oh,
basically the same kind of errors. Things
crazy.
are coded incorrectly. Things are, medical bills, medical claims, and by the time people get to me, they've already been hashed through the system. And
Right.
it's like, I'm in mid Ohio. We're farmers, and it's like they got put through the thrasher. and
Oh,
left
yes.
left a lie in the field, and nobody came along to help him out. So I kind of feel like with the knowledge that I have, and I'm still learning every day, that I can help those folks.
Changes, right? Right. It's no wonder that there's coding errors, right? I just kind of for folks that are watching and listening to us today, I just kind of want to talk about, we hear a lot about, oh, there's all, these high percentages of errors on medical bills, and so many times it's a coding issue. It's really interesting because I want to share something really quickly here that just happens to be on my desk, um, to let folks know why there might be the errors in coding and how that might happen. So,
Hmm.
do you see this book?
Yes,
Right?
I have three of them.
Right. Yes, exactly. And this, I was just about to say, and this is only one, right? This is only one book. And I want to show, like, literally, that is the typeset inside of the book. These are the diagnostic and coding manuals. So there is no way that I could ever expect there to be 100% accuracy in medical billing and coding, right? I mean, that's just not gonna happen. I don't know what just happened to my light, but hopefully it will get better.
I can
If
still
not,
see.
then
Yeah.
good. Okay. So I just kind of wanted to share with folks that are listening and watching that that there's probably always going to be a huge um error, opportunity, huge, lots and lots and huge opportunity for errors in medical bills, because the coding system is so incredibly complex. It is not simple, it's not easy. There's different codes for inpatient than there are outpatient, and like, it is over the top complex, right, Julie? And I don't know, Julie and I probably, I put her in the same bucket as myself. But I do want to say that when I first started getting exposed and experience in medical billing, I might, I might have used a typewriter to type my claims.
Ah,
Maybe.
maybe.
So, right. And so, we've come a long way, right? From typing claims on a typewriter to dropping and submitting claims automatically and electronically. That's a big change. But one of the things that I've seen as a result of that is that there's less human involvement in the process. Would you agree with that one? And if so, do you think that increases the error rate?
So here's what I know. After I left the insurance company, I worked from home for a company for 11 years. I traveled all over the United States collecting and auditing medical records for the express
Mm.
purpose of coding the five big players in the medical field: COPD, CHF, diabetes, chronic kidney disease, on and on. So what we saw was in all those travels that there are a magnitude of different medical record programs,
Right.
and none of them talk to each other. So they literally, and there are still people that do this work, they paid me to go out and fix those problems and to
Mm.
recode the chronic diagnoses, because those are the diagnoses that drive the dollars. Those are the people that are in and out of the hospital over and over and over and have the highest amount of medications and whatever. And we also had to go head to head with providers to get those fixed, even though they're, people that code that documentation from providers are not always trained coders.
Yeah.
So,
Right.
and that the codes are what drive the dollars for claim
Mhm.
payout and everything else. So when you have clients coming to you with these errors and you have the ability to look at that and go, no, let me look at your medical record and compare that to an itemized bill. You know, independent advocates such as yourself and myself, we understand what we're looking at.
Right.
It's huge. It's huge. There is not enough time to do everything that needs done.
Say that again. There's just not enough
There's
time.
not.
I hear you. There's not. But thank goodness, so for folks that might be wondering, is this something, where do you find most of your clients that you're being as helpful as possible? Like, what kind of people and what kind of situations are you able to actually affect change and help in your practice?
Oh, by far, the ones that I can affect the most change with are the ones that come to me sooner rather than later,
Ooh,
before they go to
okay.
collections. Before they go to
Say that one
collections.
again. So before they go to collections is easier. Talk to us a little bit about why it's easier before they go to collections.
A lot of collection companies, agencies, they they are more difficult to connect with.
Mm.
They're more difficult. You have to jump through several more hoops to be able to speak with them and say, wait, this bill, we're disputing this bill. We're disputing this claim. We're disputing, So I advocate, and each time I have a client, I also educate.
Yes.
Please come to me as soon as you can so that we have a better chance and you have a better chance of getting the lowest cost and the best value that you deserve.
I love that. So I think my experience has been is that people are scared to to right? And it's hard to take action in the middle of fear, right? So, a lot of times we're dealing with people who are, one, have physical ailments, right? They're sick. They're, you know,
Yeah,
that first and foremost, like that's their primary objective is to take care of themselves physically. But then in addition to that, then there's this whole layer of fear around the bills. And so what I hear you saying is take a deep breath, be super courageous, and reach out for help as soon as you realize that you're scared and there might be something there. I know for me, I would much rather spend some time with someone and say, "Hey, you don't really need me. This is what you can do," versus, "Oh my gosh, okay, we're on the backside of this. This is a real crazy mess." Is that what you're saying? Like, reach out and be courageous and ask for help, right?
yeah. As soon as you possibly get that first bill that just doesn't look right. If you think it doesn't look right, there's a big chance it's not right.
Right.
So if you hesitate, and so a lot of insurance companies and financial assistant divisions and all that, they put timelines on everything now. So if you're going to blow
Right.
past those timelines and then you want me to come in and fix it, then we have to pull a lot of more strings to get back to that place where we can maybe manage it. It's difficult.
Yeah, so it is. So I'm going to ask you to tell folks what that means. Like when you say timelines, what words might they hear from their insurance company and help us with what that means? Like what does that mean when you say there's timelines?
Yeah, so you need to always, if you have insurance, you need to get your employee handbook, your summary of benefits, and you need to know what those timelines are. So by and large, generally you have 180 days after a medical occurrence to file an appeal. Sometimes not even that much. Providers only have 60 days. And if something needs to be recoded because it was coded incorrectly, which is why it didn't go paid, Many times you only have a year if you're lucky.
To get
So
that corrected.
there's timelines. So you have to file an appeal. And I have a client right now that blew past the timeline to file an internal appeal. Now we're trying to get the insurance company to waive that so we can file an external appeal, which,
Wow.
but they didn't
Mhm.
even they didn't even have a handbook. So I've gotten that handbook for them and emailed it to them and told them they need to look through that. So
Yeah.
they've gone through all the timelines where effective negotiation can occur.
Yeah. So I hear that too. Okay, so time is of the essence,
Always.
right? So one, if you've got medical bills and you're concerned about them, one, be courageous and ask for help, right? Two, know that there's timelines and deadlines that we have to act in order to be in compliance. And one of the things that I always like to share with folks is that our insurance policy is a legal contract between me as a member and my insurance carrier, right? And that handbook, that document that Julie's referencing, really is the outline of our contractual obligations to each other in that relationship. And so those timelines are really, really important. Um, and it sounds like some of those can be as short as 60 days and 180 days, that's 6 months. And I'm going to say, Julie, so I always think at the beginning, oh, we have 6 months, we have 180 days. And the truth is that time flies
Flies,
by.
flies.
Right? It flies by. So if you have a medical bill or you have a claim that's misprocessed, know that that time is of the essence, and that we have to take action within certain time frames in order to be able to um, get the benefits that are promised to us in our contract, right?
Right. And, don't be afraid to apply for financial assistance. And that has a timeline. Those are usually 240 days. So you need to
Right?
really pay attention to get
Yeah.
the biggest bang for your buck, or you're going
Right?
to be paying.
Yeah, yeah. I think, and so I love the opportunity to talk about all of these things. And we've got some viewers. Thanks so much for joining us. If you're new here, I'm Nicole Broadhurst and I'm here with Julie Neff. Julie, what's the name of your company? I don't have it in front of me right now. I know it's Ohio. Tell us about it.
It's New Pathways Patient Advocacy. And my husband and I run the business together. He does all the back work. I do all the
Love
patient
it.
client work and all the tough stuff. We've been in
Love
business
it.
since 2019,
Woo-hoo.
and honestly, we've never looked back.
I love it. I
I
love it.
enjoy helping people, and I'm upfront and honest. Honestly, I'll
Yep,
let you know if I can help you or not,
that's
because
right.
I believe that people need a fair shot.
That's right. Absolutely. So
to-
as we get ready to close this out today, I always love to ask, do you have a favorite success story that you want to share with us today?
Oh, I have several now that I've been in business for a while. I think one of my favorites, I had a lady who did all the right things, got everything prior authorized, went to her hospital, had major surgery, and was over $80,000 in debt, and then got sick, had to go into the ER twice post-operatively, and had a lot on her plate, and didn't pay attention to the inquiries from her insurance company about the coordination of benefits. And by the time the bills started rolling in, she got real fearful and just shoved them in a drawer and forgot them. She came to me about 2 years after all that happened,
Mm,
and I dug into it, and come to find out, somebody at the insurance company had flipped her from them being primary to them being secondary, and they wouldn't pay out. So I went to battle for her. Fortunately, it was a self-funded
Oh, good.
employee, and I finally found the broker who finally found the contact at the insurance company. And after a 4-year battle, they flipped everything back to primary, reprocessed all the claims, and she walked away with less than 2,000 out of pocket.
Woohoo! That is a phenomenal story. So this is the lesson in that, right? Persistence,
You can't
right?
give up.
Persistence in understanding the system and being willing to follow the track and stay the course and hold folks accountable to their
Yeah.
actions, right?
Yeah, and
Right?
they've
I
gone all the
love
way
it.
to special counsel with the Ohio Attorney General. And I
Nice.
worked with him, and he at the end said, "Thank you for your hard work. This would not have happened if you had not been on board."
I love it. I love it. Julie, for all the viewers who are just like, wow, I want to connect with Julie, how can they do that? What's the best way for our viewers to find and connect you with you?
You can go to my website, newpathwayspatientadvocacy.com. There is a connect and contact Julie form. You can fill that out, which will come into my email. There is also
Perfect.
a phone number. And if you just want to fax me a note, you can fax me as well.
I love it. I love it. I love it. I cannot thank you enough for joining us here today to talk about Friday Friends and to share all of the amazing work that you're doing. Yes, I can go ahead and new pathways. Somebody asked me to put it in the chat, Julie. So new pathways patient advocacy. And here we go. It should come. I'll tell you what, if it didn't come through, Maureen, then watch for it in the comments. I'll come back and make sure that I get it plugged into the comments. And I'll put the website address too. I'll get that from Julie and I'll make sure that that goes into the comments as well. Okay. Love it. Thanks so much for hanging out with us today. Hey, listen, if you are an independent patient advocate or you're interested in independent patient advocacy, I'm going to invite you to join us in the circle, subscribe to the YouTube channel, come hang out with us here on Fridays where we're talking about all things patient advocacy and all of the friends of patient advocacy that you can think of. So I love it. I'm so grateful to be in your world, Julie. I'm grateful to know you. And I am so honored that you came and hung out with us. And until next week, we'll have another Friday Friend next week. And we'll see you back here. In the meantime, go have a great weekend. All right. See you later,
Thanks,
guys.
Nicole. Thanks, everyone.
Bye.